Hello, everyone. The topic of our lesson today is shock. Today, we'll go over the definition of shock, the types of shock, what kinds of shock there are, the pathogenesis of shock, and the clinical presentation of shock. Now, let's return to the definition of shock. Shock is a condition in which the organs and tissues of the body receive an insufficient amount of oxygen, which is not enough for them to perform their functions and maintain their functional activity. Shock develops when it is no longer possible to maintain a normal level of arterial blood pressure. The level of arterial blood pressure depends on three factors. The first factor is vascular tone. The second factor is the volume of circulating blood. And the third factor is cardiac output. When one or more of these factors is lacking, shock develops. A state of shock occurs in the body. There are four groups of shock. The first group is hypovolemic shock. Hypovolemic shock occurs with a sudden loss of intravascular fluid when the amount of fluid lost is more than 20% over a short period of time. Cardiogenic shock. Cardiogenic shock is associated with decreased cardiac output and is caused by heart pathology. That is, for example, there can be redistribution. Obstructive shock. And obstructive shock, this is also a shock related to impaired cardiac function, but it has a non-cardiac cause. So maybe this sounds a bit strange, right? Let's figure it out. Cardiogenic shock can be caused, for example, by a myocardial infarction, arrhythmia, severe bradycardia, or pronounced tachycardia. Or in the case of a very severe atrioventricular block, when the impulse cannot pass through. Thus, cardiogenic shock is divided into true shock and rhythmogenic shock. And obstructive shock is caused by extracardiac reasons. That is, when there is an obstruction of a vessel, and due to a severe obstruction, blood cannot reach the heart directly. This is seen, for example, in PE, in pulmonary artery thromboembolism. Or in the case of or with cardiac tamponade. Yes, for example, also with hydrothorax or pneumothorax, when blood from the vessel cannot directly enter the heart. Also, there is distributive shock. Distributive shock is characterized by a decrease, a very sharp decrease in vascular tone, which causes blood to be redistributed throughout the body. And as a result, it reaches the heart in insufficient amounts. Each of these types of shock has its own subtypes. Let's start by looking at the first type of shock, hypovolemic shock. It includes, first of all, hemorrhagic shock. Hemorrhagic shock is a type of shock associated with severe blood loss, when a person loses blood from their vascular system. This is the first type. Next is burn shock. Burn shock occurs in burn disease, when the body loses fluid through the affected areas of the skin. The third type is dehydration shock, which happens when the body loses fluid through vomiting or diarrhea, in this way. And the fourth type is traumatic shock, again often combined with hemorrhagic shock. Cardiogenic shock is divided into two types. These are true cardiogenic shock, which is associated with heart attacks, and arrhythmogenic shock, which is related to atrioventricular block. The third type is distributive shock. In our case, of course, it's distributive shock. So, distributive shock includes types such as anaphylactic shock. Yes, and then there's also exotoxin shock, neurogenic shock, and other similar types of shock. Infectious, toxic, septic shock, and also adrenal shock. These are all types of distributive shock. There is also obstructive shock, which is divided into shock associated with pulmonary artery thromboembolism and cardiac tamponade. And also in cases of pneumothorax and hydrothorax. Now, let's look at the pathogenesis, specifically of shock itself. The first stage is the compensatory stage, also known as the erectile phase of shock. During the erectile phase of shock, a person becomes agitated, their activity increases, and they experience heightened. Heart rate increases, blood pressure rises, psychomotor agitation intensifies, and breathing rate goes up. But in the inhibitory phase, or torpid phase of shock, the opposite happens. These processes decline. That is, the heart rate may still be elevated, but blood pressure drops. At the same time, the heart rate is not sufficient to maintain blood pressure levels. In other words, the heart beats frequently, but the strength of the contractions is very weak, so it's not enough to maintain normal coronary pressure. The body itself starts to shut down. At first, consciousness becomes clouded, and then the person loses consciousness completely. And the last third stage is actually the terminal stage of shock, when a person can already enter one of the terminal states, which, if the shock is not treated, eventually leads to death. So, what is the pathogenesis of shock? Let's break down several main factors in the pathogenesis of shock. The first factor is a drop in blood pressure. Then a compensatory reaction begins in the form of a partial testosterone like contraction. But it is insufficient and occurs nonetheless. There is a disruption of macrocirculation. In other words, the body cannot maintain a normal level of blood circulation. And large vessels, the same ERT. After the decrease in microcirculation in large vessels, a decrease in the level of microcirculation begins. Now, in the small vessels, the decrease in microcirculation contributes to hypoxia of the brain. Naturally, with hypoxia, there is impaired brain function. A person starts to feel drowsy, their consciousness becomes clouded, and they may lose consciousness. Then, the body tries to figure out how to deal with this problem. Since the blood isn't flowing, it needs to somehow force the blood to move. Then the adrenal glands kick in, releasing a large amount of catecholamines, leading to hypercatecholaminemia, which will be accompanied by severe vasospasm. But all these reactions won't be enough, and there will again be metabolic disorders, very serious disturbances in acid base balance, and the body will enter this kind of static state. In other words, the classic picture ends with cytolysis. So we have the four main syndromes associated with shock. These are kidney dysfunction, central nervous system dysfunction, circulatory disorders, and multiple organ failure. Thank you all for your attention. If you want to learn more about my work in physiology, follow the link in the description. Goodbye, everyone.